This is an introduction to the traction splinting station. So we're going to look over all the pieces, talk about the uses and contraindications for a traction splint, and then we'll make another video of exactly what it's going to look like for the skill station. So this is a Sager Traction Splint. There are several different types out there. The KTD, the Kendrick's traction device, is another one that's big on the market right now. But for the class, we're going to be using the Sager. So some of the pieces, first thing you're going to look at is the ankle hitch. So the ankle hitch is probably the most complicated piece. It has this padded part that's going to go around the ankle, and it velcros around the ankle. And then we have this stirrup, which the splint's going to attach to be able to pull traction. And this stirrup is adjustable with this strap on the side, so you can shorten it or make it longer. I personally think it's easy to start with the stirrup much longer, and then once we apply the splint, we can shorten it with this strap here. So that's the ankle hitch. That's one of the first things you'll look at. We also have the securing straps. These will be applied as one of the last steps of the station to secure the splint to the leg. And they usually come in different lengths. These are 24 inches and 32 inches. The larger one will go up around the larger part of the leg, and the lower one will go around the lower part of the leg, which is smaller. The traction splint itself. So we have, this is the ischial strap. It's going to go around the ischium, or up around the upper hip. This is the device that will pull out of the splint to allow us to pull traction. Once it's been pulled out, it will not go back in. It won't go in that way. So it's going to maintain that traction for us. And then we have a carabiner at the bottom, which will attach to the stirrup on the ankle hitch to help us hold traction. This wheel also, if you can see it, it does measure the amount of traction that's being pulled. So we can approximate how much traction we pulled on our patient. And we know we want to pull about 10% of their total body weight. But in all reality, we're going to use the traction splint to pull traction until the patient feels relief. So it'll basically go on the patient's feel more than anything. One other thing about this top piece here, this cushion actually flips around. So when we go to put this on the patient, you'll see that we need the wheel to be facing the affected leg so we can pull straight. So if things are backwards when we go to apply this, we want to make sure, first of all, we want to make sure, so the wheel needs to be facing the affected foot, and then we want these buckles to be facing up. So if the buckles are not facing up, there is a small button here that you can push in, and you can pull this out and then flip it over so that it can fit either side of, so it can fit either leg. This is a unilateral Sager Traction Splint. Okay, so a little bit about the use of a traction splint. Traction splints are used for people with a femur fracture. When the femur breaks, the muscles around the femur, the quadriceps, are really strong, and they try to contract to stabilize the injury. And when that happens, the broken femur bone will actually kind of cross over itself like this. And each time the patient moves, that sharp ends of the broken femur kind of act like a pair of scissors, and they could cut through that femoral artery, causing a full liter of blood loss is pretty common. So that could possibly be life-threatening or certainly put someone into shock. So the goal is to attach the traction splint to the leg and pull those bones apart so that they're now aligned. So to use the traction splint, we want to use this only on somebody who has a mid-shaft femur fracture. So contraindications, reasons not to use the traction splint. If someone has an injury to the hip or any pain in the hip at all, we would not want to use the traction splint because it would make that injury worse. Same thing with the knee. If the patient has any injury or pain around the knee, we would not want to apply the traction splint because it can make that knee injury worse. So that's why we restrict the use to the mid-shaft femur fracture. We really want that injury to be in the middle third of the femur so that we're absolutely certain there's no involvement of the pelvis or the knee. If there's any chance of the pelvis or the knee being involved, we can't use it. Another thing you'll see is we're going to attach this to the ankle, so we're going to be pulling on the entire leg. So if there's any injury to the tibia, fibula, to the ankle, to the foot, we really also cannot use the traction splint. So it's for a isolated mid-shaft femur fracture as far as we go from the hip to the toe. It can only be that femur fracture can be the only issue. We can use it for an open femur fracture. If there's an open femur fracture with an avulsion of the bone, meaning a piece of bone is actually broken off, we will not use the traction splint because at that point we don't have that bone overlapping because a piece of it's missing. So we'll have something like this going on, so there's no reason to pull traction. Students sometimes find it hard to believe that a traction splint is actually going to decrease the patient's pain. I know it sounds painful to pull in a broken bone, but it's going to help those muscles around the femur relax, and it actually decreases pain. So I've seen patients sigh in relief. We thought they were in pain, and it was actually a sigh of relief because they were feeling so much better after applying the traction splint. So I think that's it for introduction to traction splinting. I'll stop this video and I'll start another video where we actually apply the traction splint. So now that you understand all the pieces.